go, guys. So now that we've looked at the external structures, now what we're going to do is we're going to cut into the heart and look at the internal structures. So the first cut we're going to do is a V cut, and we're going to start in this pulmonary trunk. We're going to cut all along the pulmonary trunk. Then we're going to cut all the way down to the bottom of the right ventricle, and then we'll come all the way back up and cut through the right atrium. Okay, so V cut. Now the most important thing to do is make sure that you don't pass into the left ventricle. So remember this fat right here, this fat is sitting in the anterior interventricular septum. Anterior interventricular sulcus, which is the groove right there. So we don't want to cut through that, because then we'll cut through the septum, anterior interventricular septum, and go into this ventricle, and then it'll be really confusing and hard to look at. Okay, so make sure that you're only staying on the right side. So we're going to end up with this little flap that will come up, and that'll allow us to look into both chambers, the right ventricle and the right atrium, as well as look at the pulmonary valve and the tricuspid between the ventricle and the atria. Okay, and then after that, we're going to go to the left side. And from that side, we're going to cut from the top of the left atrium all the way down to the apex on the left side. And that'll allow us to look inside there. Okay, so I'm going to start with my scissors. Okay. Actually, if you have bigger scissors, now is a good time to do it. If not, your little scissors should work, but they might be a bit trickier to cut through. Okay, so once you've made your starting cut, so again, do not pass the anterior interventricular sulcus. Don't do it. You can cut with your scalpels. Remember, for the scalpels, do not cut in your hands, and always cut towards the tray. Do not saw back and forth. Always only cut in a single direction. Might take a couple of times to get through it. Go all the way as far down as you can. And then make a V cut back up. Okay, so I'm actually going to switch back to my scissors, because the walls of the atria are much, much thinner than the walls of the ventricles, and so they'll be plenty easy to get through. Okay, so see what I did here? Now I have this wonderful window inside. Looks like I didn't go all the way through with that one. Okay, so let's see. First of all, this right here, that's the moderator band. Moderator band. Now let's try to find the valve. Okay, so there are two semilunar valves. And the semilunar valves are called that because they look like little crescent half moons. And so the two semilunar valves are going to be between the ventricles and the arteries. And this would be the pulmonary semilunar valve, or often just referred to as pulmonary valve. Having a little hard time keeping it open and pointing at things at the same time. Okay, good. Okay, so see this little flap right here? Okay, so we're looking just at the boundary between the pulmonary trunk and the right ventricle, and we're going to see a little pouch. See this little pouch right here? That little pouch is what's going when the blood tries to flow back into the ventricles, that little pouch is going to fill up with blood. And so that's what closes the valve. So you're going to look for these little tiny white little cusps, little flaps, and those will be the pulmonary valve. They're very small. Okay, next we're going to try to find the tricuspid valve. Now the tricuspid valve is called the tricuspid valve because it'll have 3 cusps. Now a cusp is a flap, so you can look for 3 cusps. Okay, so here's 1, here's 2, and the third one is on the same wall that we just opened. So it'll make like a triangle shape, 3 cusps. But other things to look at is, I know that this is the tricuspid valve, even if I can't see all 3 cusps, because I know that I'm in the right ventricle. Okay, and the reason I know I'm in the right ventricle is because the wall of the ventricle is relatively thin, and that tells me that I'm in the right ventricle. So try it on the right, try it on the left. So it's the tricuspid valve would be in the right ventricle. The other thing is, I know that this is, so I see the cusp, I know it's a valve, but I know it's one of the AV valves, one of the atrioventricular valves, because of the presence of these little strings here. Okay, so these little strings, those are called chordae tendineae, and what they do is they anchor the cusp so that when the ventricle contracts and the blood is going to try to go up into the atria, okay, it's going to try to escape the high pressure, go to the lower pressure, and what that's going to do is that blood's going to get trapped into these little cusps. So the cusps trap the blood, and that closes the valve. And these chordae tendineae, all they do is they hold on to the cusp and anchor it down so that it doesn't blow back into the atrium here. Okay, so this would be, the whole thing would be the whole thing would be the tricuspid valve. Okay, so the whole structure, including everything, tricuspid valve. The strings themselves are the chordae tendineae, and the chordae tendineae are going to be anchored to a mound of muscle. So whenever I say the word mound, you should start to automatically think papillae. Okay, so papilla or papillae. So this is called the papillary muscle. Okay, so papillary muscle. Papillary muscle is this right here, this mound of muscle that the strings, the chordae tendineae, are anchored to. That's the papillary muscle, or papillary muscle as I usually say. Okay, so I want to go ahead and talk about this texturing here. So see how this right here, it has strings attached to it, that's the papillary muscle. You can also see some texturing on the walls of the ventricle. See how it has like some kind of folds in there? Those are going to be the trabeculae carneae, and they do not have strings attached to them. They're just folds, like texture on in the muscle on the side of the heart, and the side of the ventricles, I should say, both ventricles. Okay, so now we're ready to go ahead and cut on the left side here. So we're just going to make one straight cut all the way from the top to the apex at the bottom. We'll cut through the left atrium into the left ventricle. Now this is going to take some strength in here because that muscle is really thick, and I'll show you the difference. Ooh, a whole bunch of fat just fell off there. Okay, so it might take a couple of cuts to make it all the way through. Just keep cutting until you get there, and it should open up like a book. Okay, so the first thing I want to do is go ahead and take a look at how thick this wall is. Okay, so the left ventricle, it has to pump through the aorta all the way to the whole body. So it's going to have a significantly thicker wall than the right ventricle. Okay, look at the difference. So if you see a thick wall, that's going to mean you're in the left ventricle. And that's going to help with identifying this little valve here. Okay, so I look in and I see some little cusp with some strings. I know it's one of the AV valves. I know that I'm in the left ventricle, and therefore this must be the bicuspid valve. Okay, so the bicuspid valve is going to have 2 cusps, 1, 2, but again, that's really tricky and hard to see. it really works much better to just orient yourself first, know what chamber you're in, and then know that the AV valve in the left ventricle is the bicuspid valve. Okay, that's the bicuspid valve. Okay, so again, same thing. These are the cusps, the strings are the chordae tendineae, the mound of muscle is the papillary muscle, the texture on the sides of the walls is the trabeculae carneae, and the endocardium. So the endocardium is going to be, you know how the epicardium would be the visceral pericardium is the membrane that's on the outside of the heart. Okay, that's the epicardium or the visceral pericardium. The membrane that is on the inside of the heart that is lining the chambers themselves, so the shiny layer inside the chambers, that is going to be the endocardium. Endo as in inside. Okay, so this is the bicuspid valve. If you want, you can cut through your bicuspid valve. And the advantage to doing that is if you can look really deep in there, you can actually see the aortic valve. Okay, so you can actually see how it kind of comes up and it'll come out through the aorta. So if you see any little flaps, little white crescent flaps, those are going to be semilunar valves. And if you're in the left ventricle, that's going to be the aortic valve. And if you are in the right ventricle, that is going to be where is it? Oh, sorry, wrong place. That is going to be the pulmonary valve. Okay, so semilunar valves, no strings. Tricuspid and bicuspid valves, strings. That's one way to identify them. Okay, is that everything? I think that's everything. Okay.